Early Care Connection. I'm Izzy Greenberg. Today we have our resident panel of experts, Meryl Gay from the Connecticut Early Childhood Alliance and Ava Bermuda Zimmerman from Child Care for CT. First, let's always start with thanking Sandra for providing interpretation and allowing these calls to be open to so many more people. Thank you, Sandra. A reminder to our guests to speak slowly enough that she can get the information across accurately. I have turned off the Q&A for right now because we're not going to take any, we've got multiple things this morning, and we're not going to take any questions until we get past the first segment. And so I've turned that off for now. Don't be shocked if you want to put something in and you can't. I will turn it back on when we begin the next segment. And you can always use the chat for conversation with the community. Okay, we are going to start out today with a presentation from WBDC, Women's Business Development Council, and then head into a presentation on insurance from CBIA, Connecticut Business and Industry Association. So let's get started here. First, we're going to be talking about grants. So Linda Fecteau, who's the business advisor, and Sonique Solis, who's the lead contact on Child Care Business Opportunity Fund grants, are here to promote the Women's Business Development Council next grant rounds, which are beginning in February. And I'm trying to remember to reduce my acronyms for Sandra as well, and for everyone listening in Spanish. So welcome, Sonique and Linda. I'll turn it over to you to promote those grants.
Thank you, Izzy, and you got it perfectly correct. Thank you. Good morning, everybody. My name is Linda Fecteau, and I am from the Women's Business Development Council, and we have a very exciting news for you on this snowy Monday. Our grant round opens today and will be opened for the month of February. And with us today is Sonique, who is going to be walking you through our website and letting you know how to get more information about our grants, a little bit of information about the 3 different types of grants that we have, and of course, some links to join us for grant information sessions. So I'm going to turn it over to Sonique.
Thank you, Linda. Before I go ahead and share the website where all of our information is so you can absorb it at your own pace, as Linda mentioned, our grants open today. So our website will be updated later this afternoon with all those application buttons. But I will put in the chat the Zoom registration links for our information sessions, which will be today and tomorrow, English and Spanish respectively. If there's anyone on the call that may not meet the eligibility requirements or was just recently funded, there are other grant opportunities that we would love to help you access as well. Our business advisors can help you navigate the space of additional funding for your projects to increase or expand or open your childcare programs. So as Linda mentioned, and again, thank you so much for having us today, the WBDC, which is the Women's Business Development Council, is in partnership with Connecticut Office of Early Childhood, the OEC, and we have 3 grant programs that offer grants for up to $25,000 to qualified childcare businesses in the state of Connecticut, and this is through our Child Care Business Opportunity Fund. We have 3 grant programs. That is a startup grant for those who are in the process of becoming licensed, family homes, groups, centers. All our programs are accessible in 2 languages, English and Spanish. Our general website can be switched over to Spanish if that is your preferred language. We also have bilingual business advisors. If that is your preferred language, we also have individuals to help us. And we also work with an interpretation company to facilitate for anyone else that has another language preference. So I'm just going to go ahead and share the website really quickly as to not overwhelm you with information. But as I mentioned, we have 3 grant programs. That is our startup grant for family homes, groups, centers for up to $5,000, $10,000, or $25,000 respectively. Or expansion grant is for folks that are open and operating for 2 years or more, that are growing, expanding their programs with slots, 3 or more slots. and our emergency facilities grant that is open to providers who are experiencing an emergency, as the name suggests, that has your program at risk of closing, and that has a pre-application process that will help to determine if you are indeed experiencing an emergency. And that application is open until May 31st. So that is a rolling application for emergency facilities program, but our startup grant and or expansion grant will be open until March 3rd. I won't go much into details on the eligibility because we would love for you to join us at our information sessions. And I will put the link in the chat for everyone to register for our English session and our Spanish session. And if for some reason you're having any difficulties, I'll also add an email in the chat so you can reach out as well.
Soni, can you please show us just how to get to this, to all of that in Spanish before?
Sure, no problem. So if you go back to our website, on the top in that green banner, you see the word Español, and you can go ahead and click there, and it should, in a few seconds, change that to Spanish.
Great. Thank you so much.
You're welcome.
And you'll put all the links in the chat for folks.
I will.
Join. That's tonight at 6 p.m.
Correct.
All right.
And then on Tuesday at 1.
And then Sonique, you'll put in the link to make an appointment with a business advisor.
Mhm.
We highly recommend that you make an appointment with a business advisor after you've had a chance to take a look at the grant application. We are here, we're available, it's at no cost to you, and we can explain any questions that you might have about the grant process or any of your application questions, how to create your financial statements that you'll need for the applications. So, please reach out. That's what we're here for.
All right.
Thank you.
Thank you so much. All right. So Sonique, is that everything for this morning?
That is. And again, thank you so much for taking the time out to have us this morning. And our grant programs are in partnership with OEC. I always like to add, please do not pay anyone. We have a lot of network and partners that are able to assist you to access funding opportunities. So reach out to us if you have any questions. Thank you.
Thank you, Sonique. Thank you, Linda. Oh, wait, one quick clarification. You aren't taking questions, I know. This is from Ava, but can you clarify if this is for center or home-based? Is this for both home-based
our
and
grant
center-based?
programs are open to all program types, family homes, groups, and centers. And our startup grant also applies to individuals who are currently in the licensing process to become licensed.
Great, that helps us know who should come tonight.
Yes, thank you.
All right.
Great question.
Thank you so much. All right. That's great. And so appreciate that. And thank you, of course, for coming on so frequently and keeping us updated. All right, we're going to move on to CBIA, which is the Connecticut Business Industry Association. And we are going to, let's see, are you guys seeing me? Yes, I believe so. My view got, let's see, one second, here we go. All right, so moving on, we're going to introduce now Erin Kalkis, who heads up insurance sales for CBIA. She's going to talk to you all about some health insurance options that may be available for probably not everyone on this call, because some people here already have other options, but this may be useful to some folks. So Erin, thank you so much. Welcome. Just as a reminder, Erin does have a presentation in English she's sharing. We are going to share out the Spanish, we're going to try our best to share out the Spanish version of this with the recording, which will be posted in roughly 24 hours to our YouTube. I will put the link to that in the chat, and we're going to coordinate that later. So apologies to any Spanish speakers that it's not available now, but we'll get that to you later. So Erin, welcome. You can take it away.
Thank you so much. Thank you for inviting me this morning to talk about, health insurance for small businesses, which, especially in the state of Connecticut is, frankly, kind of a mess. If you're running a business and you have employees that you're trying to attract and retain, that one of the things that's most important is the employee benefits offering. So I'm just going to spend a couple of minutes. I do have about 8 slides I will speak as slowly and clearly and without acronyms as best as possible. And let me just share my screen here. Everybody can see that, Izzy?
I can, yes.
Okay, great. So again, CBIA Health Connections. CBIA is the Connecticut Business and Industry Association. Health Connections is sort of our brand of employee benefits, not only medical, but also non-medical benefits that are available to members of CBIA. CBIA is one of the oldest and largest business associations in the country. We've been around for over 200 years. And for the last 30 or so years, we have offered employee benefits to member companies at a pretty unusual platform. So essentially, small businesses can come to us through their membership. And depending on what kind of benefits you're looking for, you can get really great pricing. You can get provisions that wouldn't otherwise be available to small businesses. So it's a really nice benefit to be a member company. We also obviously market this to non-member companies, and then they become members in order to get introduced to these benefits. So first off, this slide here says new group medical plan. As I've said, we've been offering employee benefits for over 30 years, but just recently launched a new medical program. I'm going to talk about that. Let's see, moving on. But first, as I just said, why group medical works for childcare businesses? Well, because you need to compete for talent. You need to and want to support their employees and their families. And by doing so, you can build a healthier, more engaged workforce. Again, if you're running a business, you know that this kind of hits hard, right? The benefits are expensive. It's something that you want to do for your employees, but you're not always able to, either because of access or because of cost. So we are a trusted partner of the business community. We've been doing this for 20 years with small group insurance, over 30 with just employee benefits in general. Comprehensive benefit plans available through CBIA include medical, dental, vision, life, disability, even things such as, identity theft protection. So we really have a comprehensive platform for small businesses and flexible options to meet your team's needs, meaning some of these benefits are offered on a voluntary basis, which means it's no cost to you as the business owner to offer these benefits to your employees. If they elect vision, for example, they're electing it on a voluntary basis, which means you're offering them access to a vision benefit that you don't have to have any skin in the game on, right? You can pass on 100% of the cost of the benefit to your employees and their dependents. For things like medical, however, there is a rule that you have to contribute at least 50% of the lowest cost plan offering to your employees. So that gets to that flexibility. If you want to take on, 50% of the medical cost and leave things like voluntary dental and voluntary vision, voluntary life, voluntary disability, you're still able to provide options and access to these benefits without you having to actually pay or contribute anything to those non-medical benefits. So this new group medical option is offered to businesses with 10 or more enrollees, so full-time equivalent or full-time employees and their dependents. We would need at least 10 or more to enroll. We offer a very greatest hits, if you will, of the benefit plans that are in the marketplace today. Many times you'll see options from our carrier competitors of pages and pages and pages of plan designs. And it's very confusing to try to tell the difference. We have picked 6 of the most competitive, most marketed plans in the Connecticut small group offering in the market, with 6 HSA qualified plans and 3 PPO, which are sort of more traditional deductible co-insurance copay types of plans. The carrier that we're using for the network is Cigna, and it of course has a comprehensive pharmacy, not only network, but also drug list, which is what a formulary is. One of the things that's different about this plan though, and I'm going to take maybe a little step back and just sort of talk about insurance as a concept, right? Fully insured plans are the plans that came about. They've been in existence forever, but specifically since the ACA took hold in 2014, there's been sort of a shift from fully insured plans to self or level funded plans. This product is a level funded product. And what that means is, if you think of fully insured insurance, where you pay a premium every single month, it is something that you can budget for, it's predictable. And let's say it's, okay, I'll just use small numbers, easy for my Monday morning brain. You pay, say, $1,000 premium, and whether or not your employees go to pick up a prescription, go to the hospital, do whatever on any given month, you're still paying out $1,000, right? When you move to self-funded or level funding, what that means is self-funding truly says that you are funding the claims. So you're not paying a premium to any carrier, essentially. You're paying for the claims as they're incurred. Well, that's okay, right? That's how like large companies like Lowe's and Home Depot and Sam's Club, Walmart, they're all in like a self-funded plan. They're large corporations that can absorb those costs. They can deal with the sort of ebbs and flows of the claim experience from your employees. One month you could have $50 worth of claims. The next month, someone gets into an accident and it's $50,000 worth of claims. That's what true self-funding means, right? So you're not just paying a blanket, check, and maybe your employees use that money, maybe they don't. Self-funded says we're going to take care of our employees and we're going to pay for their claims. But that kind of scale is really difficult for small businesses. So there's this middle ground called level funding, which is sort of a hybrid. And what that means is we actually do a medical underwriting on the census of the employees that you plan to enroll. We, with that, sort of anticipate what kind of risk or health the group has. If it's a really healthy group, no major issues, then we're able to save between 15 and 25% off of normal fully insured rates that you're finding in the market today. And it is a predictable cost. So we're going to predict that you're going to have, $12,000 based on the health of your group in a claim fund. And we draw down that throughout the year whenever there's claims. You are still paying that predictable monthly charge for the coverage. And at the end of the year, if we have overestimated what we think your claims experience will be, there's a pot of money left over at the end of the year. It's called a surplus. And our carrier competitors, the big national competitors in the state of Connecticut, you know them, a bunch of them start with A's, they'll keep a portion of that surplus. They'll keep, depending on the carrier, between 40 and 60% of your money for, administrative costs. We charge the admin fees every single month, along with your claim fees and your stop loss fees. And if there is any money in that bucket at the end of the year, we will give back 100% of that to you as the employer. You've already paid us. We don't need to keep any more of your money, right? So that's the difference between the CBIA level funded program, fully insured, that you can find in the market, and our competitors. When you come with CBIA, it's obviously we're a business association. You are our members. We take very good care of our member companies. We're very helpful. We have a full staff of customer service and account management teams to help you. There's one point of contact for all of your care coordination, your billing. You would contact us if there's any questions on eligibility. We take the enrollment information and your monthly costs. We disseminate it back to the vendors who participate in our program so that you're not having to deal with multiple bills, one for medical, one for dental, one for vision, et cetera, et cetera. We also have a transparency tool called Healthcare Blue Book that allows employees to find the best provider, not only by cost, but also by quality. Sometimes people just go to a hospital system because that's where they think they're supposed to go for the best care. And a lot of times that's true, but a lot of times there are cheaper options for, say, surgeries. Outpatient surgeries, for example, can be done way cheaper at a freestanding surgical facility than can be done in the hospital. And most of the time, the doctors are the same. And then we've also built in $0 copays for virtual care services, including behavioral health therapy. We have virtual PCPs, right? So not telehealth like you would think, where you kind of go, oh, my kid has an earache, let me call telehealth and see what they can do. This is actually building a relationship with a primary care physician that is on screen, right? So that you're building a relationship, they are monitoring your care, just like you go to a provider in a brick and mortar setting, so that it's way more convenient. I don't know about you, but finding a PCP and trying to get in to see one within like a month or two is impossible if you're a new patient. This sort of gets you to the head of the line. They're all board certified physicians. They will order your labs. They will order your tests. You'll meet with them at a time that's convenient to you in a way that's convenient to you. And it's $0 copay if you choose that way, as opposed to old-fashioned providers through brick and mortar settings. So again, we try to make healthcare affordable for our member companies. We aren't the big guys that I talked about earlier. We're not trying to take over the world. We're trying to do what's right for our members. Again, we try to keep you on budget by returning the 100% surplus. We've got really competitive rates against fully insured plans in the market. And we have pharmacy savings that are about 20% lower than the national average by some of the vendors that we've put together and the drug list that we've managed. We sell our products through independent insurance agents. We find that it is incredibly important to have a benefits advisor. I can certainly help point you in a direction if you're looking for an insurance agent. You are too busy to run your business to understand essentially what can be a completely different language when it comes to insurance. You need to find an insurance agent who can understand what your goals are, understand what your employees need, and understand if CBIA is the right fit for you. Once you've done that, we will work directly with the insurance agent to get your group quoted, to help enroll your employees, and then to offer any service that we can provide during and through the installation of coverage. There's a lot of information out on our website, and I'd be happy to put that in the chats when we're done. I believe there might be some Q&As. I'm not sure.
Yep.
I don't. Yep.
Yep. So the number one question folks have, and this group has a lot of people caring for children in various settings, but we do have a number of people who are one-person organizations. And so the number one question we have is, do you have plans for one employee organizations, or the difference, I guess, if you're 1 or 2 employees versus 10 employees?
Right. So certainly, we do offer the non-medical options for groups down to 1 or 2 employees, but the medical program does start at 10 or more enrolled. So it depends on what you're looking for to help round out your benefits package. If you are a sole proprietor, there are programs through carriers and through the state as options for you, but unfortunately, we wouldn't be the home for you.
Okay, thank you. Meryl or Ava, do you have any questions before we wrap this segment up? Nope.
I do. Meryl, do you want to go first, or?
No, Meryl doesn't have one. You can go ahead, and then we have one
So-
more Q&A.
Extending and kind of echoing the question of sole proprietors and business owners who basically might have a handful of employees, but maybe those employees they're contracted. So in a scenario where, let's say a family childcare provider who has a larger family that assists in that childcare space, there are scenarios where the owner operator of that family childcare space might be contracting support from a husband, a cousin, another cousin, a sister. Maybe they have one floor is their husband's childcare space. The second floor is their own childcare space, go for a license, and then they have assistants that they might just be at 10 people because of the 24-hour care that they're giving. If each of those individuals are technically self-employed, but they do get to that 10 people minimum, how do you verify self-employment versus employee? If they do have 10 people that help in the operations of said business, and they're interested in being part of this plan, what options might they have, if any?
Yeah, unfortunately, we work with businesses with, W-2'd employees, not independent contractors, because those, as you mentioned, they're kind of their own. Each one is sort of their own business, the way that the state and insurance looks at consultants, if you will. So if we have a group that, has what's called a UC5A, which is the quarterly tax and earnings report that a business submits to the state every quarter, we look to that to sort of verify participation. They all employees would be listed on that because the business owner is paying taxes, workers' comp, et cetera, et cetera. If they're independent contractors, their names would not appear on a UC5A. And in fact, a really small company may not even file one. So that's what we would use as sort of the, kind of barometer, if you will, of whether or not a group, an employer is actually a group in terms of, insurance policy, insurance regulations and rules to be named an employer with taxed employees, not consultants.
Thanks,
Okay,
Erin.
that's helpful. I do have a subsequent question here. For those employers on the call, or directors, owner operators or directors, the 10 employee requirement does incorporate that owner operator themselves or their director, right? So if I'm on the call and I'm listening in and I just, did a mental head count that I have six head teachers, and then I have a rotation of three assistants. Can I count myself as a director, or can I count myself as an owner operator in that count in order to qualify?
Absolutely. Yep, absolutely. You would be considered eligible for coverage as an owner operator.
And if a portion of my staff from that head count is part-time, does that also allow me to qualify that head count? So if I do want to give some options for some employees that are working, 3 days a week rather than 5 days a week, then is that up to me as an employer to make the offer of the benefit? Or do you have some parameters in regards to part-time versus full-time employees and the listing of qualifications?
Sure. So we allow coverage. Essentially, most coverages are 30 hours or more full-time, but we do allow employers who choose to offer coverage down to 20 hours a week. So as long as they hit, as long as a person is working at least 20 hours a week on a full-time year-round basis, then we would count them as eligible.
Okay, and my last question, and I'll let someone else jump in here. You mentioned that it seems that you could be connected to an insurance broker, and through that broker with the participating plans, the owner operator or director could then navigate which different companies to choose from. So my interpretation of what you just presented is, if I want, for example, Smith Insurance, and Smith Insurance is on the participating list, then I can go with Smith versus going with Susie's Insurance. So it's not like I am forced to take one insurance option. I do have options. I just have to figure out what option makes the most sense for me.
That's right. So essentially, we are like agent agnostic, right? So we don't care. We would never tell you have to work with Smith Brothers Insurance, or you must work with USI in order to get our proposals. If if your brother-in-law is an insurance agent who sells health plans, yeah, talk to him. And if he's not aware of us or our program, we'd be certainly happy to educate him and work sort of as a team between us, the insurance agent, and the owner operator to determine whether or not we would be the best fit or another program in the market would be.
All right, great,
Thank
thank you. We do have a few more quick questions. So one question is for folks to think about the cost of becoming a member to CBIA, and people wondering how much that might offset the healthcare benefit offered, and how you chart what the membership fees are. I'm assuming
Sure.
It's based on payroll, or it's based on
Yep.
number of employees.
It's a great question, and thank you for asking it. Yes, so we base our annual dues based on the annual Connecticut payroll of the company. Dues for our smallest businesses start at $300 a year. And, we have all of the big guys, Amazon and Sikorsky and, all of the major employers in the state. They're paying well more than that, I can assure you. But there is a schedule out on our website, and it sort of goes up incrementally, with the lowest cost being $300 a month and on up. And we would never, if there was a member who was, very interested, wanted to be, if there was a company who was very interested, was interested in not only what CBI can bring to them in terms of employee benefits, but also perhaps getting involved in our lobbying efforts, our public policy efforts, we would never let membership stand in the way. So we would do some negotiating if the cost was, too prohibited at the level of payroll that you would maybe find yourself.
All right, and then the last two questions are from the same person, so I'll say them together. One is, what happens if your claims exceed what was paid? So that's, well, actually, I'll ask that separate because it's a little bit different of a question.
Okay.
There's one question after that, and then we're going to stop with the Q&A on this segment and move to the next segment.
So if claims exceed what you've paid, there is no deficit. We're not going to come back to you and say, well, we guessed wrong and fork over, 10 grand. That's not how this works. You're paying for stop loss on top of the claims fund. So, if there was a horrific year and everybody gets sick and is in the hospital and whatever, and you have exceeded your claims fund, there is stop loss protection above that so that, you don't have to worry about being called upon for a capital or any kind of money at the end of the year or throughout the course of the year. It might impact your renewal percentage. So a group that stays in the claim fund is probably going to be renewed at a lower rate than somebody who's blown through it. But there is no funds that need to come back to us at the end of the year.
All right. And the final question, and this is one that a few people are wondering about, is could there be a scenario where CBIA creates a childcare pool to overcome the 10-person threshold? The majority of childcare businesses do not have 10 employees.
So, yeah, and I certainly understand that. The problem with that lies in some legislation. That would be what's called an association health plan. And currently those are just not allowed in the state of Connecticut. They are allowed in other parts of the country, but pooling sort of homogenous industry and people together in order to get access to healthcare is not something that is available in the state, unfortunately.
That's a perfect segue, I think. Erin, thank you so much for your time. We're going to move to Chris Davis, also from CBIA. Is that, I want to just give you the last word if there was anything else you had to offer, Erin.
No, I just wanted to say thank you for your time, and I'm glad I could create a good segue from my buddy Chris.
All right, thank you so much. Okay, so next up we are going to welcome Chris Davis, also from CBIA. He's the Vice President of Public Policy. He'll be discussing health insurance policy this session, and maybe we could just start with talking about association health. Actually, what we were just taught was it association health plans. Yeah, maybe we could start there. I don't know if that's something that's in the works or on the advocacy agenda, but welcome.
Sure. Thank you very much. And thank you guys for having me. Really appreciate the opportunity to join you. I know many of you were part of our coalition last year pushing for association health plans or multiple employee welfare arrangements. So I think that's why Ava was kind enough to ask me to join and kind of give you an update on where we are this year on that issue, as well as any other health insurance policies. And the Health Connections product that we just talked about, that Erin really did a great job outlining, is kind of in direct response to the inaction by the legislature regarding AHPs and MEWAs. That was set up, and CBIA put a couple $1 million towards this new product, just because we've been running into so many obstacles in getting MEWAs or association health plans passed at the state level here in Connecticut. So we needed to create this new product for our small businesses and to have access to more affordable health insurance. So that was kind of in direct response to that. This year, as you may have read, the insurance committee is less inclined to take up the HP or MEWA initiative. There are several bills that were introduced this year to address that topic and try to create association health plans. Chairwoman Carrie Wood has indicated that she's not very interested in taking up the issue this year. She's was kind of personally attacked from many different groups in opposition to association health plans last year. She felt like the bill that was negotiated last year went kind of too far and made it a less attractive product, or the pricing wise would have been very difficult to do given the amount of regulations and requirements that were included in that bill. So she felt like that wasn't a good starting point to begin with. CBIA continues to advocate for association health plans or MIWAs to be able to be allowed. The important aspect of that and where the difference in the marketplace would be for this product compared to what you just heard about for Health Connections is that bill would allow down to 2 employees or more to pool to create an association health plan. So that's really the difference. It really would go after those really small, the 2 to 10 employers, which are many of you on this call, I know. So that's where you would have the ability to do that. So we're continuing to advocate for that. I know there's a number of other organizations that are doing so as well, including the Connecticut Bar Association, the Connecticut Credit Union League, the Nonprofit Alliance, and others that are still supportive of that and pushing for it as well. So any voice that you have in this would be great. In that bill last year, there was kind of 2 versions of these health plans that could be created. One would be a self-funded version, which would be probably the most affordable and attractive to many of the employers. That could be set up through a large association, say a CBIA, or if there's a childcare association that was large enough to pool and do that as well, and have the capital requirements in order to set one up. That would probably be the best scenario for many of these small businesses. However, the other part of that bill actually allowed for fully insured association health plans or MIWAs as well. A fully insured version would allow the companies to pool together within an industry-specific association. So you would have to only be a childcare provider to be able to be part of like a fully insured association health plan. And that would allow them to pool, look as one larger employer to purchase a fully insured product, which is a more expensive product than self-insured because you have all of the requirements that are required under federal and state law for fully insured products. That is still something that CBIA is continuing to push for as well, that if you're not going to move forward with the more affordable self-funded version, can we at least start with a fully insured version and have access for these smaller employers there? Again, it would be more challenging to set up because it under federal law would have to be industry specific. So you wouldn't be able to pool across, say, CBIA or some other chamber of commerce that has a wide diversity of different businesses. You would only be able to do it for that association associated with a specific industry. And you would have to purchase a fully insured product, but we're continuing to advocate for that as well. And there are a number of bills, as you may have seen, introduced to the insurance committee that would allow access specifically for childcare providers to purchase into the state employee health plan. In concept, that might sound like a great idea. I think there's some real challenges, especially in federal law, having access to the state employee health plan because it is a self-funded plan. So it's actually governed by the ERISA laws at the federal level. And there's no employer-employee connection there. So I'm not sure the viability of being able to do something like that under federal law, but there's a few bills that have been introduced out there that would allow for that as well. So there's a few different options out there. There's also Senate Bill 10, which is a Senate priority bill dealing with health insurance. There was a press conference on it last week. Didn't really go into allowing, any specific small businesses or trying to get more affordability for them, but it did talk about potentially trying to lower pharmacy costs through PBM regulation and reform, changing the burden on the insurer versus the doctor on which treatments are the most advantageous for the patient. So there's going to be some reform there, but nothing as far as like access and affordability from what we gather based off of the press conference as well. So it's going to be a topic that's discussed this year. There are a number of different groups that are continuing to push for MIWA or association health plan options for small businesses. And then there's also these potential discussions about either early childhood educators or childcare providers having access to the state plan. But like I said, there's some challenges to those proposals as well. So with that, I'm happy to take any questions that anybody might have about some of the bills that are out there this year or what the strategy is moving forward.
Great, thank you. Let me just, Mary has a question here. I don't know if it's for Chris or Aaron actually, but it's, does the association health plan have protections for people with pre-existing health condition?
Yes, so under federal law, all plans, whether self-insured or fully insured, would have to provide for pre-existing condition coverage. So the bill last year explicitly made that clear, although it wasn't necessary because it's under federal law that you would have those protections.
Understood, thank you. Meryl, do you have a question?
No, I don't think so.
Great, I always like to go to you. First, and Ava's translating at the moment. Okay, so what should people be on the lookout for this session? If there are things that CBIA is advocating for that folks might agree with, do they have to be members to sort of pitch in on the advocacy efforts? And how do you see, a lot of folks here may not be able to afford to join, CBIA, but may also want to push for some of the things you're advocating for, or not.
Sure.
They do. How do they learn about your efforts? How do they support them? And do you welcome that?
Yeah, so we do welcome it when we build these coalitions around these specific topics. So like last year with our Association Health Plan coalition, we opened it up to non-members to be part of that. And we actually were able to speak with Ava and kind of use her as a conduit for your community to be able to get information out to you guys on opportunities to testify on bills. We have a robust both communications team here at CBIA as well as grassroots advocacy team where we work with a lot of our local chambers of commerce and sister associations and other groups to be able to push for these types of issues. So I would say, you can sign up on our website, CBIA.com, for action alerts on legislative action alerts as well, so that you can get information about when these bills come up for testimony, or if we want to push for a bill to be raised for a public hearing or be voted on in a committee. We really kind of activate that kind of grassroots advocacy efforts at that point. So we work through organizations like Early Care Connection and others to make that happen.
Yeah, thank you. And Maria Reyes pointed out something, which is, childcare providers are in this funny space of being so absolutely vital to our day-to-day operations as a state. And yet they are small for-profit, very often businesses. Some are nonprofit, but and so they kind of fall into this area. I know one of the things that advocates work for a lot is improving pay and reimbursement so that providers can be earning wages that allow them to have any quality of life. Let's not even say a high quality of life. I mean, right now the wages are really meager for many childcare providers, but a thing that often is overlooked is the lack of benefits. And so, I think this topic specifically is one that maybe not for the larger centers who have the 10 people, to get into a plan, but especially for those folks who are holding down the fort in neighborhood-based, home-based care, or who are, working with a very small staff to provide vital care for their communities. This is an area where they really feel left behind. And so, to the extent that your efforts can include them, and that you can continue to keep us in the loop about ways this community can advocate for that, that would be very valuable.
Yeah, 100%. And we recognize that each of you are small businesses at its core, right? And having access to the affordable healthcare isn't just industry specific, it's across all industries. And importantly, the childcare providers that provide such an important role in our society and getting people back to work and having that early education that our children need. So, we very much see you guys as partners in this effort and trying to get these options available for small businesses. I do want to note too, and this isn't legislative related, but Access Health CT is in the process of putting together an ICHRA program, which would allow for businesses to use what's known as an ICHRA, which is kind of a health reimbursement account that they would be able to put money towards that for their employees to help offset costs when they purchase insurance on the exchange. They're anticipating that launching in July. There hasn't been a lot of details released yet on exactly how that would be set up. As any of you in this space may know, you can already set up an ICHRA today to have this type of product. But this would be specifically geared towards those who offer it through the exchange. And I believe their intent is to have some sort of either subsidy or additional credit available for businesses that use this specific one through Access Health CT. So we're still waiting on some more details on that as well to come out. But their intention is to launch that in July of this year as well.
And Chris, we've got a lot of folks on here. Can you just tell us what ICHRA stands for, please?
It is an individual health reimbursement account, if I'm correct, Erin. And that's under federal law. They were set up under the Obamacare legislation so that small employers are able to essentially just put money into an account for then their employees can then use to purchase their own health insurance products, whether that be through the exchange now or to go out and purchase a fully insured product on the individual market.
Thank you. Okay. All right, last call. Ava or Meryl, any questions before we wrap this up?
Yeah, I think I'd heard that CBIA was interested in supporting the large family childcare bill.
Mm-hmm.
That's having a public hearing on Thursday, and I'll put some information in the chat about how to do that. But that's a place where we clearly have an interest, a joint interest in figuring out how we can expand the supply of childcare, and that's one of the ways we can do it.
100%. So we will be testifying in favor of that bill on Thursday in the Children's Committee. I believe it's at 1:30. I think the public hearing is on that bill. So CBIA will be joining you in support of that bill and look forward to providing testimony on it.
Great.
Great. Thank you. Ava?
So we're just, well, Chris and Erin, thank you so much for being on and taking the time. This is very informative. We're curious to hear if you have maybe some testimony builder, a website or an action alert that you typically send to your own membership that maybe some of the childcare directors or providers on this call could submit through a link that you might have for bills that will have a hearing, or what your process might be.
Yeah, so if you'd like, if you have a bill that we're supportive of that you would like us to kind of activate that for, we can set something up like that. We do use a software that does those kinds of action alerts and lets you kind of fill in your information and sends like almost like the form email or testimony that way. So if there's a specific bill, perhaps this one on Thursday, and we can have this discussion about, you know, if you think it's important for us to activate something like that, we could set something up that would allow for providers to be able to send in testimony on that specific bill if you'd like. But if there's any other ones that come up, Ava and Meryl and others, you know, reach out to us and we can see if we can set something up like that as well for you guys to be able to push out to your membership.
Great. Thank you. And, you know, it has, this is wonderful. It has often been that childcare gets sort of siloed in the helper category and, you know, not always taken seriously in the business side of things. But as you said, these are small businesses. These are all business owners. Many are business owners and have those same exact concerns. So it's really great to have this conversation and to be kind of uplifting that aspect of this very important industry. So very appreciative to you both for being here. And we will look forward to more advocacy in the future together.
Excellent. Thank you guys so much for having us. We really appreciate the opportunity.
Great. Thanks again, Chris. Thank you, Erin. And thank you to WBDC, to Linda and Sonique for the information this morning. Maybe if you are still here, if you could kind of pop in those opportunities for tonight's information session. And if not, I can grab them. Actually, Meryl, you were going to report out about the governor's budget address, I believe, before we wrap up.
So on Wednesday, the governor will give his annual budget speech. There are a bunch of rumors circulating that there will be a significant early childhood piece of that. I will put into the chat the link to watch it on CTN.
I did it.
Okay, it's at noontime. On Thursday morning, the Alliance is going to be sort of going through that budget and that proposal, whatever it is, so that everybody has a better understanding of it. And then Thursday afternoon is that public hearing in the Children's Committee. The deadline to sign up to testify is 3 o'clock on Wednesday. So I'm going to put some stuff in the chat about how to sign up and the link to submit testimony if you want to submit written testimony.
Meryl, could you just describe again what the bill is, what the bill number
Okay.
is, and tell us a little bit about it?
Sure. Let me pull up the bill number here. Okay, so it is bill number 6839. Let me just stick all this stuff in the chat.
I can grab that for you.
Okay, I've got it all written out so I can stick it in the chat here easily. If it will actually copy and paste.
And that's
Okay.
HB, House Bill?
Yes.
No? Yep.
And the what this bill would do is to create a pilot program for OEC to allow family child care programs that have enough square footage to serve 12 children with an assistant. Right now, you can serve 9 children with an assistant, but I think most of you who have tried to do that or to look at the numbers have realized that you're going to end up paying your assistant more than you're going to pay yourself. So it doesn't really work. So the idea of making it possible for family child care to move into a large family child care category that is not a whole complicated group care license, that's much more akin to a center-based license and requires you to go before local planning and zoning and have the fire marshal tell you you need to put a sprinkler system and all sorts of other expensive things. And the reason that we're looking at this is that if you look at the states near us, in New York, 83% of family child care is large family child care serving 12 kids. In Connecticut, we've got like under 30 group child care programs able to serve more than 9 kids. The licensing laws in Connecticut are much harder for this than they are in New York. So that's what the idea is here.
All right, and the Children's Committee meeting, it looks like, is at 1 o'clock on Thursday.
Yep.
If you go to cga.ct.gov, folks, you can, right there, you can scroll down to the calendar, you can go to Thursday, and if you click on the Children's Committee public hearing, you will get the YouTube live, you will get the agenda and the testimony and speaker order. Can you also, let's see, did you put the link to, yep, submit written testimony? Perfect. So you have everything you need if you feel like if you are compelled to testify on that bill. As you know, legislative session is just starting, and we are going to have a lot of bills for you all to testify on. If this one's important to you, we urge you to do it, and there will be a lot more on lots of other things that will be relevant to you. So start to plan that into your weekly schedule. 10 minutes to write testimony, and there's a lot of opportunity through both the Early Childhood Alliance and Child Care for CT to learn how to tell your story and to submit that story for use on social media, for use in any of the advocacy efforts that are going on. So we'll give Meryl, I think, may have already put the or Vanessa may have already put that information in the chat for their group, and I will put the information in there for Child Care for CT as well. So that's there as well, which is get involved, and you can scroll down to all the opportunities. All right, I think now we have finished everything for today. So we've got let's see what's on top for next week. Let me tell you that before we get out of here this morning. Next week, it looks like, oh boy. Looks like I should have pulled that up before I offered to tell it to you. We've got the United Way, the School and State Finance Project, and the Connecticut Project, all telling you about various engagement and programs that are going to be of interest to you. We will put that out, of course, on the ECE listserv as always. And as always, please send an email to info@earlycareconnection.org if you have ideas for topics you'd like us to discuss. We've got a running list of things that are in the works. I know OEC is at the top of everyone's list. That has been a tough one to schedule over the last month, but we are working diligently trying to get the Office of Early Childhood back on. There's a lot of ground to cover there as well. And we've got a lot of ground to cover in the coming weeks, especially given that you all still have your businesses to run, life keeps going, and we've got the legislative session resting on all of our shoulders. So, it's busy season, and that's just what it is. Okay, thank you all so much. Thank you for being here, and we will see you next Monday. Thank you to Sandra, and thank you to all of our guests.
Thank
Have a
you.
great day, everyone.
Yep.